Welcome, everyone. Bienvenidos a todos. Good morning y buenos días. My name is Ingrid Aguirre Happold. I'm a consultant with Blue Shield of California Foundation, our host today, and a longtime leader on preventing and ending gender-based violence in California. I want to start by thanking the foundation and every organization that you're going to hear from today. They all had a hand in shaping this event. I also want to thank the Women's Foundation of California for their partnership in helping us put together this webinar. So how are we going to spend this time together? Well, what's the plan for the time today? We're going to start out with hearing from the foundation. They're going to put this national plan into context for us. We then have a presentation from a national speaker from the federal government who is going to give us an overview of what's in the plan. And we're really grateful to have Carrie's expertise with us today. We're then going to move to a California reactor panel. We have a moderator and 4 amazing organizations who are leading on gender-based violence. And then we have a full 30-minute question and answer section where all of you can ask questions of Carrie, our presenter, as well as any of the panelists. And then the foundation is going to close us out. A few quick reminders. Look at the chat throughout the webinar. Many of the reports and resources that get mentioned, there'll be links to them there. You can't put things in the chat, but you can grab the resources that are there. You can put your questions in the Q&A. And there will be a follow-up email sent in about a week with a recording of today's webinar and some links to the resources that were mentioned. So with that, it is my great pleasure to start us off by introducing the CEO of the Blue Shield of California Foundation, Debbie Chang.
Thank you, Ingrid, and welcome everyone. Thank you for being here today and for all you do every day to prevent and end domestic violence. Everyone in this room knows that survivors of gender-based violence have to navigate a lot of different systems. And it can be frustrating to see these systems work in silos, missing opportunities, making it harder for survivors and their families to receive the support they need and to heal. The goal of the Biden administration's National Action Plan to end gender-based violence is to finally get these systems coordinated. For us, the question now is how to do that in California. As you know, the feds aren't providing any additional money with this plan. But I don't have to tell this group that we can make meaningful changes that don't require money to have impact. They do, however, require time and focus and strategy. Today is our opportunity to identify those changes, to align on that strategy, and to plan for action. So I want to share with you today 3 main ideas. Number 1, domestic violence is everywhere, which means survivors are everywhere using multiple systems. Number 2, the national plan not only reflects that, but reinforces the good multi-sector prevention work that's already happening in California. And number 3, California is already leading, and we can do more. Ultimately, I hope we can come together to advocate for permanent prevention funding and a single point person at the state level reporting directly to the governor. We've seen how powerful that approach is at the federal level. So what do I mean when I say domestic violence is everywhere? Here in California, 58% of adults are affected by domestic violence, either directly or through a close friend or family member. That's more than half of us on this call. But domestic violence is not inevitable. It's healable and preventable, and we all have a role to play in ending it. If domestic violence is everywhere, so are survivors. Survivors are parents, children, students, employees. They're tenants, homeowners, homeless. They're immigrants. They're people in the military. And disproportionately, they are people of color with low incomes. Like all of us, survivors use multiple systems throughout their lives: housing, healthcare, banking, the courts, employment, social services. Which brings me to the second point I wanted to make. The national plan recognizes that survivors use multiple systems, the many systems that many of you are working on. The plan challenges and requires multiple federal systems to break down silos and collaborate. It's an opportunity to include those who have been left out of government services, recognizing that sometimes the very systems designed to serve our communities can instead perpetuate the root causes of domestic violence. At Blue Shield of California Foundation, we work to address those root causes: racism, gender inequity, economic inequity, and work across generations to prevent it from happening in the first place. Critically, the national plan includes prevention, and this is a huge step forward. My third point is, here in California, we're well positioned to take up the vision laid out in the national plan because of the good work all of us on this call are doing. We already have many proven, promising, and cultural responsive approaches to preventing domestic violence. It's just that many have been underfunded, just as the field as a whole has been underfunded. This plan gives us an opportunity to show Californians and the nation that preventing domestic violence is possible. We're calling on Governor Newsom to take 2 steps right now. Number 1, the governor could name a single state leader on domestic violence prevention and empower that person to shift policies, programs, and funding. This is something that the Little Hoover Commission recommended in 2021, and now is the time to act. Number 2, the governor can make permanent the state funding for domestic violence intervention, healing, and prevention. Some of you have already been leading the way in this advocacy. I ask everyone in this virtual room to join that effort. For too long, our field has endured ups and downs in these resources. In spite of this, we've seen some promising innovation and real success. It's why I'm so confident in saying California can lead the way, as long as all of us in this virtual room identify tangible actions we can take together. I'll leave you with this thought. This could be a moment that could go one of 2 ways. We could miss the moment and look back at this national action plan as a theoretical document that sits on a shelf. Or we could make California a model for the rest of the country that might even inspire federal investment. If anybody can make this happen, it's the leaders on this call. So let's get started. I would now like to introduce our featured speaker, Caroline Bettinger Lopez. She's a tremendous leader in the field. She is Senior Advisor on Gender and Equality for the Office for Victims of Crime in the U.S. Department of Justice. She's currently on leave to serve in this capacity from her role as law professor at the University of Miami. There, she directs the Human Rights Clinic and Human Rights Program. Thank you so much for joining us today, Carrie, and being such a valuable resource for local and state governments that want to build on the momentum of the national plan like we do in California. Thank you. Let me turn it over to you.
Thank you so much, Debbie, for that very kind and generous introduction. And I want to thank all of the organizers of today's event, as well as the interpreters for your tremendous work in gathering together such a diverse and exciting group of participants in today's call. So I'm very excited to present the national plan to the listeners here, and then to engage with the panelists following my presentation. And then the most fun part, which is to engage with audience questions and answers. And I want to just kind of emphasize that this is one of many conversations that I've been engaged in with the field, with many different fields. And a point that Debbie made, which is so important, is the idea that we're hoping that these conversations can both enrich and deepen the work that is being done in the field of gender-based violence, broadly defined, but also allow us to forge deeper and broader connections with folks in other lanes, in other quote unquote proverbial silos. And so this national plan that I'll talk about today is very much about getting out of our silos, as Debbie said. So let's get started. We have a PowerPoint that I'll be walking you through with some visuals that hopefully will give you an opportunity to understand more about the plan. So next, this is introductory slide. I do want to say this is a national plan to end gender-based violence that was released by the White House in May of 2023. This was an interagency effort that really took about a year and was really developed side by side with many different stakeholders in the gender-based violence field and beyond, including many of the speakers that you'll hear from today and many participants who are listening in today. Next slide, please. The national plan was released, as I said, in May, and it was originally named in an executive order from March of 2021, where President Biden called for the establishment of the White House Gender Policy Council. This was the first gender policy council in any White House, so it's a very exciting development. And that executive order called for the development of a national gender strategy, which has a set of 10 priority areas. And one of them is gender-based violence. And then the executive order also calls, as you see kind of in the blue highlight, for the creation of a national action plan to end gender-based violence that establishes a government-wide approach to preventing and addressing the problem in the United States. So very importantly, this national plan that I'll be talking about today is part of the implementation of that larger national gender strategy. Next slide, please. And I'll run through the next couple of slides pretty quickly, but this is important. There is a vision statement in this national plan, and I think that is very important for anyone who is trying to come up with a comprehensive strategy or plan of action for government or for any any body, because if we have a vision statement and if it is rights-based, as this plan is, that sets a very important values statement for us to be able to understand what we're doing and why we're doing it. So here, this vision is very broad for all people to live free from gender-based violence in all aspects of their lives. And it refers to a variety of different factors, intersectional factors that we want to make sure that we name. Next slide, please. There is a definition of gender-based violence in the plan, and for those of you who are interested, you can take a look at it. We very carefully developed this definition, again, based on many conversations, including with experts in the field. We wanted to draw upon the range of interpersonal violence across the life course that many federal laws and policies focus on, including sexual violence, intimate partner violence, stalking, and other interconnected forms of violence and coercive control. But we also went to pretty great lengths to make sure that we were squaring this definition with global definitions of gender-based violence, including the definition that was put forward in the newly released what we call the global GBV strategy, or the global the strategy to address gender-based violence at the global level that was released by the State Department and USAID. And we see these as our companion pieces, both a domestic policy approach and a foreign policy approach to thinking about ending gender-based violence. Next slide, please. Next slide, please. Thank you. Okay, so as Debbie mentioned, very importantly, this plan identifies gender-based violence as both a public safety and a public health crisis. There is a strong emphasis on public health in this plan, which I know resonates very much with the approach of many of the speakers on this call and many folks in California who are doing work to end gender-based violence. It takes a life course approach and really focuses on an intersectional approach as well, for folks of different backgrounds, and across the life course. Next slide, please. We have a few graphs and graphics in the plan, and we really sought to use these as an opportunity to both lift up existing graphics and approaches that the U.S. government has offered, but also to emphasize kind of the vision of the plan. Here, for example, a graphic that really talks many of the ways that Debbie just mentioned about the lasting impacts of gender-based violence on health, opportunity, and well-being, and connecting the dots between gender-based violence and injury, mental health, maternal and women's health, opportunity, including education and housing, and income-related issues, risky behaviors, chronic disease, and infectious disease. Next slide, please. This is a little snapshot of the at a glance section of the plan. For those of you who don't have the time or capacity to read a multi-page plan, this is your opportunity to read the Cliff Notes. It starts on page 7 of the plan, and I know the links are in the chat, and we'll be sending you those links afterwards. But this at a glance is a quick snapshot of the 7 pillars, which I'll describe in a moment, and talks about the goals and objectives of each of those pillars. So this is an example of one that focuses on pillar 1, which is prevention. And I'll get into a little bit more detail in a moment. Next slide, please. Okay, so as I mentioned before, any plan needs to have a set of guiding principles. What are the principles? What are the values that guide that plan? And here, again, these are ideas that we heard time and again from advocates, from survivors, from academics, from folks in government of different levels, local, state, and other nations' governments that we engaged with as we were developing this plan. Centering the voices of survivors, recognizing the connection between gender-based violence and gender discrimination, taking that intersectional approach that I mentioned, and the rights-based approach. Again, the public health, public safety, and life course lens. Promoting a federal leadership and coordination across sectors, just as Debbie was saying, that interconnectedness, grounding policies and programs in evidence and research. So those are some of our guiding principles, and you'll see those reflected in some of the subsequent slides. Next slide, please. So these are our 7 strategic pillars. This is the meat of the plan, and this is how we kind of organized the strategies for action, as I said, the goals, objectives, and strategies for action. So the 7 pillars are prevention, first and foremost, naming that as a top priority for us. Number 2, having support, healing, safety, and well-being for survivors, families, and communities. Number 3, economic security and housing stability. Number 4, online safety, including a focus on online abuse and harassment. Number 5, legal and justice systems. Number 6, emergency preparedness and crisis response. And number 7, research and data, which is a cross-cutting pillar. You see it reflected across the other pillars as well. Next slide, please. Okay, I see that I'm going too fast. I will slow down. I apologize. Okay. Pillar 1, prevention. So I'm going to focus on a few of the slides that I think are of greatest interest to this audience. And again, happy to do a deeper dive during the Q&A. So in pillar 1, prevention, we're really focused on using a public health approach to strengthen primary prevention efforts and building the evidence base of what works to prevent gender-based violence. So this means enhancing and promoting prevention work and activities, and disseminating those existing prevention strategies that we know work. and as well as, in particular, thinking about changing social norms that support or condone gender-based violence, an issue that is very important to President Biden. And finally, thinking about improvement of comprehensive health approaches to prevent gender-based violence. Okay, next slide, please. This is just a snapshot again of another image. This comes from the Centers for Disease Control, their model, their social ecological approach to violence, this 4-level model that focuses on violence at the individual, relationship, community, and societal levels. And I'm sure that's a slide, that's an image very familiar and near and dear to many of your hearts. Next slide, please. Pillar 2 is another area that I know is very important to many of you on this call today. The focus on support, healing, safety, and well-being. So this is where, and this administration has really placed a priority on this. The Office for Victims of Crime, where I am based, has placed a very large focus on promotion of trauma-informed, holistic, accessible, and culturally specific services and responses for those who've experienced trauma as a result of gender-based violence. And so here we are looking at the experiences of survivors, also those who have used violence, and how we come up with holistic responses, particularly for survivors from marginalized and underserved communities and across the life course. Next slide, please. The third pillar is also, I know, a priority for many Californians, economic security and housing stability. And so here we're really interested in the spheres of housing, workplace safety, and economic security. And so the 3 goals in this space include a focus on sexual harassment in the world of work. And we do reference the new ILO Convention 190, which focuses on gender-based violence and harassment in the world of work. There's a lot of interesting and important work going on in this space at the global levels as well as in the United States. Improving economic security and looking at the many different places where economic security gets made or broken, including asset building opportunities and financial protection, and long-term financial independence. And finally, last but of course not least, is the sphere of housing, providing a spectrum of housing services and programs and protections, both in terms of shelter and then safe, affordable, and long-term housing. Next slide, please. Pillar 4 focuses on online safety, which is, of course, an area that we are, can you all hear me okay? I want to make sure.
Yes, we can hear you, Carrie.
Okay. The interpreter froze for me, so I wanted to make sure it wasn't on my end. Okay, there you are. Great. Okay, so online safety, creating safe and accountable online spaces to improve the prevention of and response to technology-facilitated gender-based violence. And this really is reflected in the creation of an online task force to address a task force to address online harassment and abuse, as well as a global partnership on online abuse and harassment that the United States has formed. And so we're doing a lot of work, again, coordinated work across our agencies and at the global level on this issue, on technology-facilitated gender-based violence. Next slide, please. This slide on Pillar 5 focuses on legal and justice systems. And of course, we have a very broad focus on various systems. Debbie referred to several of these: criminal, civil, immigration, and military justice systems, as well as community-based approaches. And I know that, of course, in California, there's been much interest and focus on restorative practices. And in this pillar, we have kind of a threefold set of goals. One, on advancing access to justice for survivors. Second, making sure those systems are responsive to survivors. And then third, expanding options for survivors to seek safety and justice. This idea that there is no wrong door for survivors to go through, and that we need to fortify alternative pathways, multiple pathways for survivors to be able to define their own solutions for seeking safety and justice. Next slide, please. Pillar 6 focuses on emergency preparedness and crisis response, the connection between gender-based violence and public health crises and natural disasters. And we talk about deepening the evidence base, as well as thinking about training programs for first responders and finding ways to have our federal response efforts better respond to survivors. Next slide, please. Pillar 7 focuses on research and data. As I said, it's a cross-cutting pillar. Every single pillar I just mentioned needs more research and data. That's another theme that Debbie mentioned before. And this is very much on our minds in the federal government right now. How can we expand and deepen the evidence base and do so in a way that draws upon the lived experiences of survivors and families and communities, so that we're both expanding the idea of whose voices go into the creation of research and the understanding of research products and the development of the research itself, as well as expanding the scope of what we are looking at, what we are examining. And so this pillar intends to do that. Also leveraging existing data collections to collect new data. Next slide, please. The last part of the plan focuses on an implementation, on our implementation efforts. And just briefly, there's kind of a fourfold set of implementation efforts. We want to integrate with broader equity efforts at home and abroad, as I've mentioned, with the global GBV strategy, as well as the national strategy on gender equity and equality. We're seeking whole of government coordination, connecting the dots across the agencies. We're seeking monitoring and accountability. And that's a very important part of these national plans, is the metrics piece, the evaluation piece, the monitoring piece. And finally, the ongoing consultation and engagement with survivors, advocates, and the field broadly defined. Remember, this is an implementation plan for the federal government. This was a plan designed by the federal government for the federal government, but it is also meant to inspire and connect with efforts at many other levels. Next slide, please. I want to just point folks, anybody who's interested in thinking about or understanding what the federal government has already done with respect to these 7 pillars, Annex 1 contains a list of key federal activities with links to all of the different initiatives that you'll find. And Annex 2 contains links to key executive actions and legislative actions in the gender-based violence space. Next slide, please. I just want to very quickly point to San Francisco. You all in California are leaders in thinking about connecting local initiatives or state initiatives with global initiatives. San Francisco was, of course, the first city in the world to adopt the Convention on the Elimination of All Forms of Discrimination Against Women, which is also known as CEDAW, C-E-D-A-W. Sorry for the interpreters. I know that was long. Okay, go ahead. Next slide. I want to point you to Chicago, the city of Chicago, which developed its own strategic action plan to address gender-based violence and human trafficking. So this is already being done in multiple governmental contexts. And next slide, please. And finally, just to kind of bring us back to the global context, the United States is now one of almost 80 countries on every continent except Antarctica that have developed national plans, and UN Women has a whole handbook about developing these national plans. And this ties into things like the 16 Days campaign of activism against gender-based violence. Next slide. This is just a snapshot of some of the other countries that have developed really interesting national plans over the past decade or so. Next slide, please. And this is just also just a quick visual of some of the listening sessions that went into the development of this plan. And again, big shout out to colleagues and advocates from across our country and around the world who contributed to our federal understanding and enriched our understanding. And that's my own timer. So I think I have just finished. Next slide. Let's see if I have anything else. Just the added value. And I'm happy to talk more about this in the Q&A, and I've mentioned a lot of this, but just this whole of government approach that really calls for the federal action, but also calls for collaboration beyond the federal government. We've developed this multi-sectoral blueprint. And again, I'm happy to talk more about the added value. Next slide, please. And again, this is another slide, happy to return to it. This is about the whole of government approach, what it means to kind of build upon some of this key legislation that many of you have been very closely connected to over the years. The Violence Against Women Act, the Family Violence Prevention and Services Act, and the Victims of Crime Act, and what it means to kind of build upon those pieces, create a coordinated community response within the federal government, and then lifting up areas that have really been underemphasized in past research and policy, including prevention, including intergenerational healing, and community wellness, and social norms change. Yep, and go ahead, next slide, please. And finally, if you would like to reach out, you're more than welcome to contact me, and we'll be sending this information out. It's so exciting to be with you all, and I really look forward to the rest of the program. Thank you so much.
Thank you so much, Carrie, for your presentation and for the succinct presentation. Hi, everyone. My name is Gustavo Lopez with the Alliance for Voice and Men of Color, and I'm going to be moderating our Q&A session. But first, I want to introduce a panel of California leaders who are going to help us reflect on what this plan means for our state. I'm going to introduce first the first speaker. Each of them will speak for about 3 to 5 minutes, and then they will each introduce the person following them. After that, we're going to open it up for questions for Carrie and the whole panel, and we're going to get started with Sandra Enriquez, CEO of Valor. Sandra?
Thank you for the introduction, Gustavo. It's so great to see so many people from all across California working to end gender-based violence. Welcome to all 300 plus participants. Qué lindo es ver a tantas personas de todo California trabajando para poner fin a la violencia de género.
It's really nice to see everybody in California to end domestic or violence gender.
For your dedication to funding gender-based violence prevention work in California. Your unwavering support sends the message that you are joining our collective call to prevent and end all types of violence. If you ask any Valor staff what one of our goals is, we'll always say Valor leads with prevention. We've played a large part in advocating for the importance of including prevention in the national plan, including hosting national listening sessions and leading conversations about prioritizing prevention. Not only is prevention the first pillar in the plan, demonstrating the importance and urgency of it, but it will ultimately end gender-based violence. Over the years, we've worked hard to advocate for federal and state investments that support our efforts to prevent sexual and domestic violence. This has led to some funding. The Rape Prevention Education Program provides essential federal funding to the California Department of Public Health, and now has started to support Valor as the State Sexual Assault Coalition. Despite the investments at the federal level, we have not seen this reciprocated in California. Until recently, we've largely seen no investments in prevention in the state. Through our collective advocacy, done in partnership with my colleagues who are present here today, we work closely with the state legislature to educate them about prevention and the importance of investing in it. We've seen the allocation of one-time increments to support innovative prevention work. Most recently, in 2021, The state invested 15 million in one-time funding, and this past legislative session, they invested 2.3 million to extend the one-time 2021 allocated funding. This funding creates unique opportunities for customized community-based prevention programming and strengthens California's efforts to prevent sexual and domestic violence. From the creation of AAPI youth-led leadership programs in Los Angeles, to the Promotores model in San Bernardino County, to multilingual family prevention programming in Tahoe. This funding has allowed programs to reach out to their communities and help them start visualizing what it truly means to be a violence-free community and put that visualization into action. When we talk about prevention, we need to think about a comprehensive, holistic approach. Prevention investments need to be sustainable and ongoing because we know prevention takes time. Prevention changes communities and systems, and that work cannot happen overnight. As mentioned in the national plan, we must be investing in prevention programming that promotes protective factors and is tailored to local communities. The national plan calls for changing social norms across systems and institutions and teaching skills to prevent gender-based violence. But we cannot do that until we start to take investing in prevention seriously. We need to invest in efforts to prevent violence from happening in the first place. And we also need to be investing in solutions to prevent it from reoccurring. Engaging in restorative and alternative justice solutions to support a survivor's healing journey is violence prevention. As called out in the national plan, Pillar 5 urges for the expansion of options for survivors to seek safety and justice. It is essential for us to recognize that survivors are not a monolith and deserve an array of options. And Blue Shield amplified this in their podcast episode released earlier this week, featuring Valor's friend Sujata Baliga and Dr. Tiasa Bankhead, educating about the effectiveness of restorative justice practices. Everything that the federal government has outlined as part of a comprehensive whole government approach requires sustained funding. Funding to research prevention best practices, funding to support survivors' unique healing journeys, funding to develop community-based programming, funding to prevent violence from happening again. This work is interconnected. Now is the time for California to lead the nation and set a standard that we need a statewide effort to prevent and end gender-based violence. Thank you. And I am now excited to pass it to a passionate leader, Keely Linton, representing the Culturally Responsive Domestic Violence Network. Keely.
Okay, thank you. And thank you for this opportunity to comment. I am Keely Linton. I am Ipe Nkupa, a citizen from the Mesa Grande Band, and the Executive Director for Strong-Hearted Native Women's Coalition, which exists to enhance the capacity of survivors, advocates, victim organizations, victim service providers to end violence against American Indian and Alaska Native people. I am here today representing the Culturally Responsive Domestic Violence Network, CRDVN, a statewide network of 20 domestic violence prevention organizations culturally rooted in their local communities, collectively focused on centering Black, tribal, and immigrant women, on transforming California's domestic violence prevention system of care to better serve historically marginalized survivors, inclusive of the LGBTQ+ and deaf, hard of hearing survivors. As the leader of an organization working to center the experiences of tribal families in a domestic violence context, I'm very heartened to see this coming together of like minds and those who are here to uplift cultural approaches to ending domestic violence in our communities. What does culturally responsive domestic violence prevention look like in practice? An example is our CRDVN member organization, Korean Family Services, or KFAM. KFAM takes a non-shelter-based approach. KFAM works closely with the church, which serves its largely immigrant community and is a critical partner in addressing cultural patterns and solutions. KFAM trains and supports ministers and provides ongoing support via the church and its network. 3 other organizations working with immigrants from the Mexico and Central America, Mujeres Unidas y Activistas, the Mixteco and Indígena Community Organizing Project, and East LA Women's Center, all use promotoras, peer leaders, leaning on a peer support model to build trust with survivors. Women experiencing violence get support from those who share in their experiences and their culture. Our tribal programs provide healing circles for survivors, incorporating a form of art therapy, using our traditional customs to provide survivors and youth a safe space to talk and support each other in their physical and spiritual healing. These and others like them are non-shelter-based approaches that are essential to assisting women historically outside our system of care and meeting them where they are with a cultural, trauma-informed approach. And while responsive prevention looks different based on community needs, there are some universal truths. For women, economic independence is essential. The CDC has found that even a small increase in family income is linked to a decrease in family violence and recommends strengthening economic supports to prevent domestic violence and strengthening household financial security. A report at California's Hoover Commission recently highlighted creating economic pathways for domestic violence survivors is a major priority. And what does economic security look like in a domestic violence setting? At CRDVN, we focus on 3 areas. One is social enterprise, a cafe like My Sister's House, serving Asian immigrant communities in Sacramento, where survivors are trained and employed in a small business. 2, financial coaching, like Asian Women's Shelter, where refugee women budget and plan for their family's future. And 3, fundamental workforce development, making training and employment programs statewide that are responsive to the needs of domestic violence survivors. We applaud the national plan's intentional focus on uplifting tribal survivors and survivors not centered in mainstream domestic violence response. For sustained shifts, we need to see system change. For example, over the past few years, our statewide network has focused on shifts in workforce development support through policy change to call out domestic violence survivors and assessing job training resources, and to connect with the California Workforce Development Board to advocate for culturally responsive workforce training. And what we found is that domestic violence survivors are not seen as their audience. Many of these programs are geared toward men and not toward vulnerable domestic violence survivors with a cultural relevant lens. CRDVN is proud to be part of a statewide budget ask for more support for culturally responsive approaches, but more sustained investment is still needed. Imagine a job training program built for survivors, responsive to their language and cultural experiences, and accessible to survivors in their vulnerable circumstances. What might it take to create and fund a job training program for domestic violence survivors and have it as a model not only for California, but nationally? For too long, domestic violence prevention has been siloed off as distinct from economic justice, housing support, and other basic needs. The truth is, economic well-being and autonomy is prevention, and pathways to economic independence are essential across all communities. All of the community organizations represented here and so many participating in this webinar are all supporting violence prevention at one stage or another. We should be thinking about violence prevention as integrated into all we do and funding the continuum of care accordingly. This national plan is the momentum we need to set us on this pathway. Thank you so much for your time, and I will now pass this off to Kirsten Stewart from Futures Without Violence.
Thank you so much, Keely. As was said, I'm Kirsten Stewart. I'm the Vice President for Policy and Advocacy at Futures Without Violence. Futures is a national nonprofit social justice organization that works to prevent violence and end violence in our homes, communities, and online, and to help all people who have been harmed by violence heal and thrive. I want to thank the Blue Shield of California Foundation for including us in this distinguished panel. It is indeed an honor to be with you. One of the groundbreaking aspects of the NAP was its focus on looking at gender-based violence through a public health lens. This means understanding prevention in a more comprehensive way, as we already heard discussed, and also looking at the experiences and social conditions that can contribute to gender-based violence, and also really looking at how the health and public health systems can address prevention and healing. The NAP had very specific recommendations, as Carrie mentioned, around health and public health, setting a specific goal around improving healthcare approaches to prevent gender-based violence and help survivors heal. Fortunately, California is already engaged in some really exciting initiatives to remake many of the systems that come in contact with vulnerable families, and in particular, the healthcare system. I'd like to focus on several key opportunities that the NAP highlights and that California is well poised to address. By far, the largest opportunity is through Medi-Cal. This is California's Medicaid program, and it is going through a significant multi-year transformation called CalAIM. It changes who all can get services, what kinds of services are covered, who can provide those services, and one of its big goals is to have health and social services more seamlessly integrated. One of the biggest new covered services is what's known as dyadic care, care that provides you can do parents, for instance, and children together. We believe this is particularly helpful for parents and kids who may be experiencing domestic violence. But, and this is an important but, there's going to need to be advocacy and education to help both community-based programs and health systems understand what's possible and understand the importance of integrating violence prevention into adult and child-centered health and parenting programs. For instance, home visitation programs or perinatal programs could integrate violence prevention into work that helps adults, survivors, and builds good health and resilience for the children they serve. This is in addition to things like clinical interventions like parent-child psychotherapy and evidence-based intervention for parents and young children experiencing violence. We need to think through who are the different types of providers with a focus on early childhood as well. Many of us are also aware of some of the gross disparities we face when it comes to maternal and infant health. Black and American Indian and Alaska Native mothers and babies die and are injured during pregnancy and childbirth, and immediately thereafter at much higher rates than others. But what many people don't know is that domestic violence and the trauma associated with sexual violence and other forms of violence are major contributors to those disparities. There are now new funding streams to cover the cost of doulas and community health workers. You heard mention of promotores, who many women of color, for very good reason, prefer to see for their care. We also are working to see if DV advocates could also be covered as community health workers. California is also undergoing a transformation in how it provides youth and behavioral health services. Those of us on this call know how much experiences of domestic violence and sexual assault contribute to behavioral health challenges for young people. But those connections are not always as clear to providers themselves. So as California ramps up the services it provides and who provides them, it's another opportunity for partnership. They need to hear from us about how they can safely meet the needs of youth experiencing violence and how they can promote prevention by promoting healthy gender norms and relationships. One of the other key pillars called out in the NAP is the importance of economic security. And you heard Keely just address this as well. In terms of, we're thinking about, for instance, helping people get some of their basic needs. And it's an essential tool for prevention and healing. As you heard, it was discussed previously, but now healthcare programs are increasingly addressing patients' social needs, such as food, transportation, and housing, often with funding from Medicaid. The bottom line is we need to be advocating and educating the state agencies that administer health and public health programs
and managed care plans about the powerful role they have in preventing and addressing violence. We also need to help them understand this isn't just us asking them to do one more thing. Rather, we are helping them meet their own goals. If you want to reduce homelessness, depression, or close the maternity care disparity by 50%, one of the stated goals, you need to address gender-based violence. Finally, it is important that we start early with young people to help them build healthy relationships, to know what they look like, and develop the skills necessary to achieve them. So this is a key part of prevention you already heard discussed, but we're focused on the social norms as a key element of the public health approach. Adolescent programs, due to what's happening in California, are now better positioned to address this. In particular, we need to engage men and boys as leaders and role models and drivers of social norms. Social norms can be critical in both condoning violence, but also importantly in creating the norms that discourage dating violence or other harmful behavior like bullying. The Alliance for Boys and Men of Color, who you've already heard from Gustavo today, is a leader in California in helping young men and boys of color, providing culturally responsive programs that tap into cultural and community strengths as tools for reducing gender-based violence. Since time is short, I'd like to thank you for your time and pass the Zoom mic, as it will, to Elise Moore-Olben of the California Partnership to End Domestic Violence.
Thank you, Kirsten. This is Elise Moore-Orby. I'm the Executive Director of the California Partnership. My pronouns are she, her, and hers. And I am in the beautiful land of the Ohlone people, also known as Northern California or Bay Area. I want to welcome all of our local programs that are on this call today. Thank you for participating because this call would mean nothing without you. You bring more meaning and possibilities to this conversation. I also, of course, I want to take a minute to thank Blue Shield, who actually made this conversation possible. And so Blue Shield is always in our front yard, in our backyard, digging up gold and treasures that enable the movement in California to do wonderful things. And I just want to give them a shout out and say thank you again, Blue Shield. I also want to take a minute to stop and breathe in this success. The national plan has been a long time coming, and it creates tremendous possibilities. So I want to thank our national leaders for doing this hard work. I also want to take a minute and celebrate community-based programs here in California and across the nation who have made the National Action Plan possible. This plan is not new information, but the strategic synthesis of years of reporting successful work done by local programs and TA providers across the country. So the partnership acknowledges and celebrates your contribution to this National Action Program plan. And we want to thank you for leading and modeling the work that needs to be done right now and in the thank you. So I want to quickly go through a couple commitments from the partnership. The partnership, first of all, I want to say we commit to continue this conversation around the National Action Plan and what it means for California and how we can use it. We also commit to continue learning from promising practices across the nation, as well as survivors, to provide California with emerging training, technical assistance, and mentoring to support survivors and their communities from the margins to the center. As we look at the National Action Plan, I strike that. The partnership will continue to elevate the needs of survivors and prioritize intersectional, culturally specific approaches and strategies that strengthen prevention, health equity, justice, community-based healing practices, policy advocacy, builds collaboration between traditional DV programs and restorative justice programs, across government agencies and multidisciplinary agencies. And finally, prioritizes measuring short and long-term impact of our work. I tried to slow down. I hope I did a good job of that. The National Action Plan, as you know, comes to us. So if we're going to develop strategies to expand, deepen, sustain the critical work we have been doing and need to do, we have to get out of our silos. That's our first call to action. We have to get out of our silos so that we can build a collaborative statewide movement that will enable the sustainability of our work. We also, I want to lift up, although Keely did an excellent job already, we need to recognize and respect and elevate Black, Indigenous, people of color leaders and culturally specific, serving the most marginalized communities. We cannot be California without elevating the need to have very specific work for our most marginalized communities and our communities of color. We have to also build advocacy power for more statewide funding. Again, that takes statewide collaboration. So out of our silos, working together to build statewide collaborative funding. And I want to add, lastly, I think I have enough time, that we have to pursue a more cooperative and diverse philanthropic strategy. So we've been depending on statewide money and state money, and some small foundation dollars to sustain this work. Cannot continue as such. We have to be intentional about coming together, again, getting out of the silos and developing a cooperative and diverse philanthropic strategy to build the sustainability of this work. Thank you so much for being at this meeting and for all that you do to make California a safe and healthy place to live.
All right, thank you, Elise, for your remarks and for all the panelists. I'm going to ask all the panelists to come back on camera so that we can move on to the Q&A. We've been getting a lot of really great questions in the Q&A, so please keep them coming. But I think to get started, I think one of the themes that I picked up on from a lot of the panelists and from your presentation as well, Carrie, is the issue of funding. This plan is really impressive, the national plan, in terms of all the important issues that are being uplifted, and it's clear that it took a lot of work to get here. But it's also apparent that there's no funding attached. So I'm wondering if you can speak to, Carrie, of any particular advocacy efforts at the national level that folks can try to get more funding directed to these goals that California should be aware of.
Thanks so much for that question. So what I can say is that my observation is that national plans, and there are many of them, right? We have a national plan on human trafficking, national plan on HIV/AIDS, national plan on antibiotic resistant bacteria even. So we have many national plans in the United States. And many of these, most of these create some sort of a vision statement, as I talked about, and a set of priorities. Whether or not they have funding attached to them, they provide a roadmap and a blueprint, both for the federal government and for advocates in the field, to guide future funding, programming, and initiatives. So, so I can tell you that the 14 different agencies that are involved in the implementation of the national plan are carefully looking at, and they announced this during the launch, they are carefully looking at how their own policies and programming and funding align with the plan, and then thinking about kind of where new initiatives or funding or programming might further develop some of the plan's goals. So I can't speak in detail about anything kind of future facing that hasn't been publicly announced, but I would point, for example, and I can put this in the chat, to recent funding announcements from the Office on Violence Against Women at DOJ or the Office of Justice Programs. And I would also encourage folks to look at HHS, at the Family Violence Prevention Services Office, and other HHS components, as well as the Department of Labor Women's Bureau. Those are some places where there's some really interesting and innovative programming and grant making that is very closely tied to and aligned with the national plan. And so again, I can put out this more information. For example, OJP, the Office of Justice Programs, just announced, I believe it's $4.4 billion of grant making, much of which aligns with many of the priorities of the plan. The Office on Violence Against Women is also engaged in, of course, the implementation of the Violence Against Women Act, which has many different funding directions, and this plan really helps to reinforce and move several of those forward to the next phase, I think.
That's really great. Thank you, Carrie. And I think folks will definitely be excited to see some of those links shared to those funding opportunities. Maybe to shift the conversation a little bit, one thing that I found really gratifying to see in the national plan, and that you uplifted in your presentation and other folks touched on, was the uplifting of non-law enforcement approaches to addressing gender-based violence. Here in California, we've been working very hard to expand efforts to do restorative and collective justice to address domestic violence. But even here, this has been a strong issue to move forward. So I'm wondering if you have any advice or any gleans of wisdom for us working in this intersection between domestic violence and restorative justice. Are there any other states that you know that are pursuing this work?
So I, like many of you, have heard about really exciting local, oftentimes community-based efforts that are underway to pilot or advance different ideas on restorative practices or restorative justice. I don't want to uplift anything in particular because I feel like that's not my role as a representative of the federal government. But what I would say is, as folks know, OVW, it put out a restorative practices. They put out a proposal for seeking a restorative practices project that is underway, being considered. And then there's a lot of really exciting language in the plan itself that I really want to just point people to, because I know California is giving such careful thought to this, and there's really interesting work going on there. So if you look in goal 3 of pillar 5, as I mentioned, that is the pillar, the goal that expands options for survivors in seeking safety and justice, this no wrong door, alternative pathways model. As you said, many people have touched on this. And there we specifically say that strategies for action include supporting research on the effectiveness of co-responder models, that we should be developing training and enhancing support for local and state jurisdictions, instituting effective co-responder or community responder models, and that we should be evaluating those restorative approaches. So those are very important, I think, marks of our values. Again, we also say there that we need to be investing in programs implementing restorative practices, such as the pilot program on restorative practices authorized in VAWA 22 that I mentioned. Others may want to chime in here, but yes, I myself have heard about really interesting work that's being done in California, Illinois, New York. Those are some places that come to mind that I've heard really interesting kind of nascent or further developed projects and work on restorative or transformative justice. And again, others may have a lot of expertise here that they want to share.
All right, thank you, Carrie. And I think it's really exciting to also hear that call for the need for evaluation and robust implementation of these programs, because I think it really sets up other states and here in California for us to be able to implement these type of programs. So now to turn a little bit further, and this is a question for the whole panel, picking up on a lot of the themes that you all touched on your remarks and your reaction to the national plan. Many of you have raised this idea of having a centralized leader on violence prevention here in California. I'm wondering if you could speak on like what this could look like and what would be the benefits to having one centralized leader. And this is a question open to you all for the panel. So whoever wants to address it first, please come off mute.
Okay, well, I'll go ahead and jump in and then see if my colleagues want to jump in as well. One of the things that the NAP again really highlighted, and when we think about this again from a public health approach, is you need systems talking to one another. Like we all talk about, survivors' lives are not, housing over here, childcare over here, food here over here, and yet those are how our systems are set up. And so by having a centralized leader, hopefully positioned in a place kind of high enough up that they have a little muscle as well, they can start to bring these systems together. So the healthcare services are talking to the folks who are administering TANF, who are talking to folks who are administering the earned income tax credit, who are talking to folks who are doing housing and childcare and transportation, right? And so we can better integrate those systems instead of relying on survivors to have to navigate all kinds of other systems during these times when they're so vulnerable. So that's one core advantage.
I'm on the fence about one single person. And so I'm sure there are pros and cons to that. And surely some good things could come out of it. But it also puts us at risk for a lot of other things when you have a single leader. The responsibility and the burden of one person trying to be the voice for such a diverse state and needs. That person is forced to become political in their decision making. I mean, just so many things. And so I'm not saying that's the wrong thing to do, but I think it bears lots of conversation. And it feels it also feels a little patriarchal for me and just feels like a very traditional approach. When I think we're trying to move to a place where we practice diversity and shared leadership and recognize the power. So it feels like an old time strategy to me as well.
Yeah, thank you, Elise. Any other thoughts on this question about having a centralized leader?
Yeah, I mean, I think Sandra, obviously we would need to take steps and be very thoughtful about it. I know that in previous years, a lot of those of us here on the call have advocated for a senior advisor on gender-based violence. I think at the federal level, we've seen what, even the White House having an advisor, what that's been able to do. So, I think it could be a good idea. And again, to hear Elise's caution, I think that we do need to be thoughtful about how we would go about doing that.
Thank you, Sandra. Okay, to shift a little bit again, one question that we keep seeing in the chat is again about funding. And while it's really impressive and important to see this national plan, we at the same time, just a few months later, we are facing VOCA cuts that are diminishing the capacity in California for programming, for services, for prevention. And we have also seen inconsistent allocation of funding to support innovative programs and other prevention programming here in the state. So how can we think about using this national plan, this opportunity as a springboard for collective priorities when the funding landscape is so challenging in California, at the local level, at the federal level? And again, this question is open for the whole panel.
This is one where I'll jump in. And I think it really comes down to partnerships, right? And trying to not be the one that has to do everything. So that's why we sort of emphasize that kind of integration and working with other systems. So if they can be taking on some of the load or providing some of the services, you as a program don't necessarily need to do that. I will also say, not specific to the National Action Plan, but this administration put forward serious dollars through the American Rescue Plan, including very specific funding, tens of millions of dollars to states, specifically to address health consequences of domestic violence. So there are resources. It was tied in some ways to sort of providing mobile health and sort of building health advocacy and those connections between programs and public health. But again, if we can use these dollars to help create that integration and build those partnerships, hopefully that could potentially lead to more sustainable funding down the road.
Hi, I'm just going to jump in again. First, I want to just acknowledge and say thank you to the California Governor's Office of Emergency Services, CalOES, who I believe or saw was on the line at some point, and CDPH, because both of those state organizations have been very supportive and listened to the needs of the state. With that being said, we are looking at some significant cuts coming from the federal government through the Victims of Crime Act, which is for California projecting. It could be even greater than this, but looking at about a $700 million reduction from previous years. And so, and that would be starting in July of 2024. So we really do need to take action in the state. I know that because this is what funds a lot of the California safety net for victims. Just wanted to mention that Valor and the California Partnership to End Domestic Violence have mobilized quickly to form a robust coalition of statewide organizations that represent hundreds of direct service providers from around the state that serve victims of crime. And what we're doing is we're requesting $200 million in ongoing funding from the state to support the gap in federal VOCA funding. If anybody wants to join with us to help support that, we welcome that. We obviously need the state of California to step up and ensure that services can continue to be provided there. And also that we don't lose any of the advances that we've already made in prevention and making people or helping people to understand that funding prevention is important and that prevention works. Thank you.
I want to jump in here too and piggyback a little off of what Kirsten was saying about partnerships. I think part of what we really need to look at too is and I think I saw a question in the chat too about, the foundations and other philanthropy organizations that support economic justice and different avenues, and really shifting the language of gender-based violence to really show these foundations and other potential sponsors and funders that what they are supporting is also supporting gender-based violence and victims and survivors. And how do we shift their lens to begin to support what we're doing and then the work that we do in prevention and building those relationships outside of federal and state funding as well. And I think from a cultural perspective and small organizations, we've had to think outside the box a lot because we don't typically get funded, and we have to support our communities in any way we can. And so we've slowly developed these types of relationships. We really need to make that statewide. We really need to make that conversation statewide so that there is more support coming outside of the state funding and outside of federal funding for gender-based violence.
Thank you, Keely, for that. I just to pick up on a thread of something that you just mentioned on how we're framing gender-based violence and how we are working with foundations. One really interesting thing about this 2021 Little Hoover Commission report is that it's really important to create these economic pathways for gender-based violence survivors. And Keely, you mentioned the idea in your presentation about creating these job training programs that could serve them. And as you're just pointing out, so many foundations here in California who work on economic justice issues don't really fund gender-based violence often. So I'm wondering if you could share, and again, open to everyone, any thoughts on how we can break down this barrier, how to move away from these silos, and get more funders to work in this space of gender-based violence.
Well, and I'll speak a little bit from just my experience. So working in this field for 20 odd years, and we're so focused on grant-based response and seeking responses. And so we have this language that we've used for so long that we just kind of cut and paste all the time. And what we really found that we needed to do is change that language up. Most of our community doesn't speak in, the term domestic violence or family violence. So we have to change that language into our community language so that they understand what the work that we're doing and the type of prevention. And so when we started doing that, we had more community participation. And then we realized we need to do that same thing for funders. So when we're talking to different foundations and organizations, we changed the language up a little bit about what projects do we need for our survivors. And we started to see more funding coming in to support our shelters, to support, being able to get rent to, our clients. So it's a little bit of money, and locally that's a small start. But I think if we can change, how we and teach our domestic violence people how to speak to funders and foundations in a different way, so that it's hard. I'm not a trained fundraiser, right? I'm in social services, and so but we have to make that part of our conversations with our staff, so that we know how to then speak and kind of sell our programs and what we're doing in a unique way, so that they understand that they're supporting what they want to support is really the same thing of what we're doing in the gender-based field. So I don't know if that's a great answer, but it's like a small step that we're working towards. So
yeah, no, that's great. And you're speaking to the experiences of what is happening in the field. Elise, I saw you come off mute. Did you want to share?
Thank you, Gustavo. I want to piggyback a little bit on what Keely shared. I think it's a very key point that she made, which is about how we use the language, language we use. And I think one of the things that the National Action Plan gives us as an opportunity is to start using different language. Organizations, I was just talking to a person that works with private donors and community-based foundations across the nation, and he said most of the people that he talks to say, "Oh, we don't fund domestic violence." And I'm like, well, that's not really what we're talking about. But I realized the language, and so I think that the National Action Plan gives us an opportunity to stop talking about domestic violence and start talking about this work from a public health perspective, and talk about the transformation and the prevention and the healing that needs to happen. And when we begin to make those shifts, I think we'll find more allies. I mean, we're in one of the, if not the richest, one of the richest states in the United States. The tech worlds, we live in the land of the tech people, and these multi-billion-dollar organizations, their whole work is about changing culture. That's all they're doing. They create new technology that changes culture. And so in my mind, I've always felt like California, as a state that prioritizes prevention, that we have a lot of alignment. We could have a lot of alignment with these big tech companies who are shifting culture. That is what we're trying to do. We are trying to shift culture away from some of the old thinking that shows itself as what we call domestic violence, but really is a health issue. So I just want to say, yes, Keely, we need to start changing our language. We need to evolve our language. And we also need to just start naming what it is. It's a health problem. It's a cultural problem. It's a societal problem. And we need to make those changes. We need to shift culture. This is not about what happens to an individual, what another individual does. Is what this society creates and perpetuates of people against one another.
Thank you, Elise. I think that call to action to change how we approach, changing our approaches and to uplift what the national plan is, which is a very powerful tool to refer to remind folks here in California that this is a public health issue, that we need new approaches to work to end gender-based violence. We have just a few minutes, 2 minutes left of the Q&A. So I'm going to ask a really broad and difficult question, I think, for you all to wrap up. And just picking up on this theme that Elise and Keely were touching on is how we continue to broaden our base of support to end gender-based violence here in California. Who specifically should be more engaged?
I'm sorry, Gustavo, could you repeat the question?
Yeah, as we're talking about the way that we're framing and the narratives, you know, we touch a lot on the ways that we need to change the way that our approaches to how we work with government, how we work with funders. But just thinking about the base of folks here in California who are working to end gender-based violence, like who else do we need to be working to engage to bring into this work?
So you're asking who's not at the table?
Who's not at the table? That's right.
Yeah, I want to jump in here. We actually have a project funded through Blue Shield of California Foundation called Influencers for Justice. And what it recognizes is that there are everyday people working, they're not domestic violence experts, but that they have access and reach to people that traditional people in the field may not have access to, and that we need to see prevention of gender-based violence as everyone's work. And that I think we need to embrace those folks, whether their approach looks a little different than ours. That's okay, that's great. And that's really the way that we're going to really make a dent at ending gender-based violence, is not to be exclusive, but to be more inclusive.
I'm a backup singer for Sandra.
I love to hear it. Well, I think that concludes.
Oh,
Oh, go ahead.
I would just quickly say that in addition to both kind of the usual suspects as well as the broader fields that we're talking about, youth leaders have been a very important set of voices in our construction of the national plan, and want to just always remember to kind of uplift youth and the next generation and hear their thoughts about how we move forward.
Thank you, Carrie. Well, I just want to say thank you to all the panelists for all your shared wisdom, and to everyone in the audience for all the great questions that you put in the chat. We definitely did not have time to get to all of them, but we'll continue this conversation. But to wrap up, I will pass it to Lucia Corral Peña from the Blue Shield of California Foundation.
Gracias, Gustavo. Can you all hear me? Great. So I have the privilege of thanking all of the amazing speakers we heard today. Debbie started us off with really a challenge. And the challenge is really, we can either miss this opportunity, this moment that the National Action Plan created, or we can leverage this moment to collaborate, co-create, and drive some new change. And I hope, I know that those of us here on the call, both as attendants as well as participants, as well as speakers, are here to drive to work together to drive that change. Debbie also offered permanent funding for prevention as a policy solution, single point leadership at the state level that reports to the governor and that is accountable to our communities. Carrie, in her wonderful overview of the National Action Plan, underscored the importance of the National Action Plan as part of a broader national gender strategy. And it's a tool designed to enrich and deepen gender-based violence work across the nation, and California has an opportunity to really lead the nation in embracing what all the pillars in the plan, especially prevention. I want to highlight a theme across all speakers, which was one intention of the plan is to foster connection and getting out of our silos. The reactor panel, I think I heard Elise, I heard Keely, I heard all the presenters speak to this, and give concrete examples, which I will get to. I think one of the most important things that Carrie did is focus our effort and our thinking on the why. She said, gender-based violence has long-lasting impacts on health, opportunity, and well-being. And as a result, all people should live free from gender-based violence in all aspects of their lives. That is such an important thing. We see that in our families in California. We see that with survivors. And when I use the word survivors, I'm using the word with reference to all genders. I'm thinking about children, families, communities, BIPOC populations in our state. We outlined collectively that interpersonal violence should be looked at across the life course. We talked about gender-based violence as not only a public safety and even a community safety issue, but a public health crisis. Prevention is so important, and prevention requires different approaches that need to augment the essential safety and justice systems that we have in place. Gustavo mentioned the need for innovation and evaluation, using and lifting up restorative and collective justice as an example. And the panel, and again, all of the speakers really talked about how to de-silo using really promising examples. So I'll just say really briefly, what we heard today is gender-based violence and interpersonal violence prevention is an anti-poverty issue. It's an economic security issue that is integral to prevention, housing, and safety. It is a family issue, and it is a funder issue. And as a funder, Debbie and I want to really underscore and create a call to action for our colleagues in the field. The Women's Foundation, Blue Shield of California Foundation are ready to partner. So with that, I know time is up. I just want to close by saying one last thing, which is I met with Sonia Passi from Free From yesterday. She's the executive director of that wonderful organization. And she encouraged us to share that we need an abundant mindset. This movement is rich in committed advocates. It's rich in compelling stories. It's rich in the potential for partnership. And we heard much of that in the wisdom and examples shared today. Thank you, everybody, for being here. Thank you for the organizers. Thank you for our speakers. And most of all, we hope to continue the conversation. Blue Shield of California Foundation stands ready to continue coordinating a California response.